Good morning. Trey and Cory here, back from Vegas. A little bit poorer, but a lot wiser for the wear. We just got back from MedicareCon 2024 in good old Las Vegas, Nevada. So, welcome to Health and Retirement, the talk show of golden advice for your golden years. I'm your host, Trey Basa, Senior Healthcare Advisor with Market Medicare Advisors, and I'm joined by my colleague, Cory Hiebert, also Senior Healthcare Advisor with MMA. Hey, thank you for joining me today. Really appreciate it. Dude, how was Las Vegas?
Oh, man, Vegas is it's always a lot of fun. You know, we go down a day early to experience Vegas, have learn a little bit about the blackjack tables, how easy it is to give that money up. But as nerdy as it may sound, man, I love MedicareCon every single year. I love MedicareCon. We get to meet with a lot of the industry professionals, a lot of the people that, we represent products here. We don't offer the products. We don't decide what these healthcare plans do, which is sometimes a little funny to try to explain to people when they say, hey, why didn't this work? I don't run your healthcare plan. I just know how the healthcare plans work, so I can represent them. But it's awesome to go to a place like that and be surrounded by other agents and hear stories about how they're helping people out in their communities. And then you get to hear from the industry professionals and what they're offering as a product and where they're wanting to take their business. And it's just really refreshing that whenever I'm talking to somebody, I want to tell them, like, hey, Physicians Mutual is an awesome, awesome company for dental. Here are some of the reasons that I like them. But then I didn't just read about Physicians Mutual on the internet and then start talking to people about it.
MedicareCon is a opportunity for us to go and converse with these professionals and get to talk to them about what they're doing and where they think that they're moving. And it gives us an opportunity to build that relationship with people that are on the other side of the phone. Because you might not be able to always call in, get into the customer service line and talk to a representative with your health insurance. Whereas Cory and I, we've met these people. They can get us to the right department as soon as possible. They can, heck, we text Andrew every now and again, and he sends out little texts from that's our guy with an insurance company who wants to make sure that we're doing the best by our clients. And so MedicareCon 2024, really awesome experience. That was my first year, but that was your second, third year?
That was my second year going out there. They're growing, the insurance industry as a whole. We have a lot of great people. Trey, I tell this to almost everybody that comes into my office, and that's, I fully understand that I might not be the right fit whenever I sit down and start getting to know you. The person across from me, they may not jive with my style or the way that I talk to people or the way that I handle my clients. But it's so important that even if it's not me, if it's not you, they find somebody local that they're able to talk to. And it's really refreshing to go to a place like that. And then whenever I'm talking to these other agents and I hear, we like to come on here, we like to go on our other shows, our TV show, and talk about how we in our office are helping out people in the greater Wichita and Kansas City areas. But it's great to hear that there are other agents nationwide that are doing the same exact things that we are. And Medicare agents in general are really do have Medicare enrollees' best interest in mind.
Yeah, talking with a lot of these agents at MedicareCon makes me really understand that there are people out there that have Medicare beneficiaries' best interest in mind. And it's those people that are making the efforts to go to these conventions, to connect, to establish themselves in the industry, but they're also holding those client meetings in office. They're going to houses and homes to have those face-to-face interactions. It's these people that we're running into at these conventions that are doing more than just sitting by their phone, making those dials day in and day out, just talking to people across the country just because they have a name, a phone number, and a birthday. Like, oh, you're turning 65 here soon. You want to talk Medicare? If not, they probably just whisk it to the side and say that's a loss. Whereas us agents, independent brokers, going to these conferences, we're conversing with everybody to number one, make sure that we are in the know as much as possible. We get to see a lot of cool products, things that are coming out. We get to see demonstrations of different resources and even talk to these professionals in these industries and learn from them, as well as connecting with them and other agents across the nation. So if you guys want to stay in the know with all things Medicare, hey, perhaps you want a professional examination of your Medicare options, you can give us a call at 316-252-8707, or you could always email us at mail@marketmedicareadvisors.com. That's going to take us to our second segment, and this one's a little bit different. It's going to be a video clip. We were very busy at MedicareCon 2024. When we sat down at our booth, what was our main thing? We did all of these connecting conversations over a setup just like this. We sat down with agents and we talked about what are they doing in the industry, what are some stories that they could share with us, and what could we learn from them. Cory, you did one of those interviews. What did you think? How did you think like our setup?
Yeah, no, it was great. It was just the same environment that we do here. Our stories can get a little old, boring, or redundant. You guys hear Trey, Mark, myself, we're constantly on this stuff. We wanted to give an opportunity to anybody that works in the Medicare field to have a chance to talk about what they do and how they are helping people out. So it was great to get a little footage, and you guys are going to hear some stories here in a little bit about other agents' experiences all across the United States.
This is what we're going through in the Wichita, Kansas City area, but this video is to show you that there are other agents out there that are working just as hard as we are to provide XYZ to their Medicare beneficiaries. Sit back, check out this video, and I'll catch you on the other side. Welcome to MedicareCon 2024. Today, we're starting today's interviews off with Bill Green, owner of Green Insurance.
So we do it all. We do health insurance, life insurance, annuities, long-term care. Medicare and health insurance is really my passion. I've just seen a lot of people in my life not get really good help when it came to their health insurance and their Medicare. So that's where I really want to focus on helping people.
I start relating with these folks because my parents right now are in that age as well. Not only my parents, but also my aunts as well. So I can quickly relate to them, and that's the thing that I look at when I'm sitting with them. I'm like, what is it that, if this was my mom or this was my aunt or even my dad, what do they need?
So I always like to say my name is Phil Lovelady. That's my real name. I'm not that clever. So I got a good decade of talking to thousands of people, working with that big corporation. 2021, I went independent, moved my FMO over to BBI, Justin Brock, MedicareCon guy, and it changed everything.
My name is Bernard Mosby. Everybody calls me V. I am from Richmond, Virginia. I have a full-service insurance agency. We focus on Medicare, but we do all different types of insurance, including health insurance, life insurance, annuity rollovers. So we specialize in Medicare. We eat, sleep, dream, daydream, and everything about Medicare. We do Medicare 101s. We meet people where they are. You can come to us. Anything about Medicare, anything about senior benefits, that's what we focus on. However, we also add, and we do focus as well on life insurance, disability, burial plans, health insurance for people at 65 and under, because everybody's not of Medicare age. So what are we going to do with those individuals who are between 55 and 65 that need health insurance?
I started in 2002 in the insurance industry quite by accident. It was like a third, fourth, fifth career. And loved it. It took care of the medical background that I came from. I worked in a property casualty agency, and they're like, you know those medical words? Yeah. So you do this.
The seminars are essentially how Medicare works. We've taken the Medicare New Book and pared it down to a little under 45 minutes of what's actually important to them. and how they can get the most benefit out of Medicare, as well as what Medicare is not going to cover, and then how they can put an umbrella with it to make sure that the costs they do have, no matter what Medicare plan they pick, are still covered in some way.
Well, I have found that the main thing about Medicare is that clients find it to be very confusing, and they're afraid of making a mistake. So that's what I help them learn about. It's all about how Medicare works, and really get to know them and understand what they're looking for so that they feel comfortable at the end about what their choices are for Medicare.
The other thing is I have, me being a veteran myself, I served in the Marine Corps for almost 8 years. I come across those veterans who are misguided on not having Medicare because they have the VA, or if they have TRICARE and they have the VA, but they want to save an extra few dollars just to put back in their budget. There's options for that too. So there's just conversations that are not held because people don't know, or they're even just misguided because you have somebody who doesn't know anything about Medicare, but they have a strong opinion, and sometimes they have a strong influence, and they'll end up misguiding somebody just because of that.
What can you do for them?
I would say education and honesty, and letting them know what is good, helping them find out what is good for them. Medicare is not only, I'm sure you hear a lot of agents say that it's not a one-size-fits-all. Everyone knows that in the business. More importantly to that, it's also not one geographical location fits all. And so what we do is we help people find out what is good for them and where they are.
I am really going to educate them on Medicare and exactly how Medicare works, exactly what they're going to get from the government, exactly what we can help provide to them, and the different options that are available. And we're going to get them signed up and ready to go whenever is appropriate for them.
Not only are you juggling 100,000 zip codes in California, you've picked up all of these other states. How do you do it? How do you juggle?
Well, we are just so fortunate that under Mint, right, we have multiple agents that speak different languages, including American Sign Language interpreting services, which we just began to offer to our beneficiaries as of October of last year. And we just train them individually so they can service the members in the states, in the zip codes. So you're not going to get a one number where you call and you're going to speak to a kind of like a monotone recorded. Yes, no. Wherever you're calling from, we're going to get your zip code and we're going to connect you with an agent that services that area. Why? Because they get to know. They know that area best, and they know their needs. They know how to meet their needs. So definitely one of the things that we take pride in doing, making it personable.
I try and talk to my clients in really like plain everyday English, like you would talk to somebody at the grocery store.
And having that medical background is a huge advantage.
Right.
You know how to translate the gobbledygook into everyday speak.
Yeah, that was a big advantage in that world. The partners that I work with were super happy if somebody said the word blue, health, pills, something. They're like, I don't know, man, talk to Pam. And if you want to talk about cars and homes, I find that boring. You can talk to those guys. So we have a really good mutually parasitic relationship in the office. And so we try to be the one-stop place where you can get your home and auto insurance, get your health insurance, I work with the younger crowd, the Affordable Care Act crowd. They age into Medicare. I get to write my own Medicare policy this year, which is really strange feeling, but...
So the one thing I would say take away is education, helping people find out what's good for them.
Because it's important when they retire or when they're moving to individual insurance, it is going to be their insurance pretty much for the rest of their lives.
Yes, and if it's not that plan, we will be with them for the rest of their life, as long as they want us.
It's reassuring that we're not the only agents in the area, in the country, that are putting so much effort into helping people like you with their Medicare options, with any hurdles that they might face when approaching Medicare age or even changing plans. That video is to show that we, as independent brokers, are working hard for you in a number of ways. And going to MedicareCon is a huge step forward for us as agents. We're connecting with other people with resources across the nation to make sure that as independent agents with Market Medicare advisors, we're doing our best for you and our current clients. So if you have a precarious problem that you want us to talk about, you can schedule your complimentary no obligation consultation with Market Medicare Advisors. Just give us a call at 316-252-8707, or maybe shoot us an email, mail@marketmedicareadvisors.com, with a question. Speaking of which, segment number 3, our mailbag segment, straight from mail@marketmedicareadvisors.com. I have a question from Chris in St. Louis, Missouri. And Chris asked, I have a bunch of mailers and phone calls flooding me because I'm turning 65 soon. What do I need to do to make them stop? You go for it.
That's a awesome question, Chris. To interject a little personal anecdote in here. Trey, we're constantly on the web looking up Medicare this, Medicare that, Medicare the other. Chris, I relate to this. I get the same mailers talking about Medicare and asking me to sign up into my own personal mailbox. No beating around the bush. I'm 25 years old. we joke all the time that Medicare is a long lead time. But
your search history is indicating otherwise.
Right.
You're about to turn 65.
Right. Well, in 40 years, I might reach out to some of these people that have been sending me mailers. Chris, the best thing to do with the mailers is just to make yourself aware of what is going on with these mailers. A lot of times you'll see in very tiny print towards the bottom, it'll say not affiliated or endorsed to buy the federal program of Medicare, or so on and so forth. Because some of those letters can look pretty scary, and they look like they're coming directly from Social Security or Medicare, when in all reality, it's just somebody trying to get your information. And then, Chris, when it comes to the phone calls, I had a really awesome conversation with a gal. Oh, she might not have thought it was so awesome. It was about a week and a half ago. And she was talking about all these phone calls that she's getting. And I asked her, hey, so what are you doing whenever you get these phone calls? Because her phone rang 3 or 4 times while we were in our meeting. So what are you normally doing when you get these phone calls? Well, I'm not answering. I'm just hanging up. Well, Trey, there are some times that you and I will call people that we may have talked to, year, 2 years ago. If we don't get a hold of them and we have to leave a voicemail, that just means that we have to call them again. And we might have to leave another voicemail. And we'll do that until we get told to stop. I have no problem taking somebody off of a call list. If you don't want to hear from me, if you don't want to work with us,
fine.
By all means.
Yeah.
You're not going to hurt my feelings. But I don't know that unless you tell me that you don't want to talk to me. And we can put that down. We can mark that and say, hey, Joe Smith doesn't want phone calls anymore. And Joe Smith, you'll never hear from us again. But if you're not answering and you're just rejecting those calls over and over and over again, they don't know that the hint is not always there, that you don't want to talk to them. You have to tell them that you don't want to talk to them.
Yeah.
And it's just that easy.
It's really the mindset of as what those phone calls are intending to do is get you on the phone to talk to you about your Medicare options. And more likely than not, they are captive brokers wanting to talk about one set of plans from one company. Those practices they work, unfortunately, but you have to take the initiative, let them know, all right, hey, I picked up your phone call. I hear you. I don't want to talk to you. And they should, keyword, take you off that call list.
Yeah, no, they legally required is the greatest way to say it. Legally required to take you off that call list. But Chris, I'll go one step further with this, and that even when we get people on the phone, we're never asking right there initially on the phone in that first phone call, what's your Medicare number, what's your date of birth, address. That is not information that you should give to anybody unless you are confident in the person that you are talking with. You've met them, you know that's who you're going to enroll with. Even if someone says, hey, I just wanted to check some benefits on your plan. Can you give me your Medicare number?
Oof.
No,
Never.
do not give your Medicare number unless you know who it is you're talking to on the other side.
I think with our phone calls, we aim to educate, and we look for how we can help them. And it's with that education piece that people have the confidence to pick up that phone, answer the phone call, and say, hey, I'm good. It's that confidence that we give our clients to answer the phone and say, I don't need to talk to you. Please take me off of your list. And that might make you feel better when you're receiving all of those mailers, emails, Facebook ads, all of those phone calls. With that education piece that we give, instilling confidence in you to just shrug all of that off. Because what they want is your business. They want your time. They want your Medicare number to do business with you, ultimately. If you have a question that you want to feature on the show, write us an email or give us a call, 316-252-8707, or mail at mark@medicareadvisors.com, and we might feature your question here on our show. But I think that's going to wrap it up for us. Any final thoughts? MedicareCon 2024, rated out of 10.
Yep, 10 out of 10.
10 out of 10. My first year, it was a spectacular experience. I cannot wait for next year. Maybe I won't go a day early for Vegas. Maybe save myself some money. But it was ultimately really rewarding, and I'm so happy that I went to connect with all those other agents. That's going to be it for today. Thank you so much for joining us for another episode of Health and Retirement, the talk show of golden advice for your golden years. We'll see you next time.
Unless otherwise indicated, all client and prospect names mentioned on this show have been changed to protect the identities of the individuals discussed. The content provided is intended for informational and educational purposes only. The views, statements, and opinions expressed herein are those of the individual speakers. This is not endorsed or affiliated with any U.S. government agency, the Social Security Administration, or associated with any federal Medicare program. We do not offer every plan available in your area. Any information we provide is limited to those plans we do offer in your area. Please contact Medicare.gov or 1-800-MEDICARE to get information on all of your options. Investment advisory services are offered through Foundations Investment Advisors, LLC, an SEC-registered investment advisor. All rights reserved.